healthcare needs of Singapore's population are changing. The rise of long-term complex health conditions and an aging population requires our healthcare system to transform so that we can deliver sustainable, value-based care. Through the key pillars of care redesign, efficient technologies, and workforce transformation, we can drive innovation and productivity to improve the lives of our population.
Patients admitted to the inpatient wards are routinely placed on 4-hourly vital signs monitoring, which is an age-old practice and impacts on resources for other aspects of patient care. Using this quality improvement project, we hope to de-escalate vital signs monitoring using a nurse-led approach.
We designed a low-risk criteria in which nurses identified hematology-oncology patients who could be monitored once a shift instead.
Reducing unnecessary vital sign monitoring results in less disturbance to patients, particularly at night and in those who require palliative care. Nurses are also empowered to redirect their efforts to other aspects of care, such as patient education, fall prevention and quality improvement.
This project is aimed at achieving seamless and coordinated care integration for hip fracture patients from admission to surgery, rehabilitation, and post-discharge community services. Our project redesigned care in several key areas. Firstly, integrating the hip fracture pathway from the acute hospital to community hospital. Secondly, standardization of community hospital discharge criteria. Thirdly, weekly multidisciplinary round at the community hospitals.
As part of the process care redesign, weekly MDRs allowed decisions to be made in a timely fashion and reduce waste and unnecessary ALOS. Initiatives such as the group therapy and weekend admissions to the community hospitals resulted in earlier attainment of rehab goals, which reduced the ALOS.
This project allows staff to complete tasks and processes in an efficient way, and the innovation is actually instrumental in improving patient experiences, safety, health outcomes, and costs.
This initiative has demonstrated how supply chain redesign as well as leverage on technology has brought about greater value for hospitals and its end users.
Both teams performed a comprehensive site study on Tan Tock Seng work processes and agreed on 3 innovative changes. Number 1, to support from the offsite facility. Number 2, the use of a vertical lift module for accurate picking. And number 3, the use of ordering systems to reduce administrative work.
By adopting innovation as well as working hand in hand with technology, we are able to reduce the amount of stress as well as the manual work for our staff.
As the only piano service in Singapore, we were faced with limited resources and challenges to manage the current and future national workload. One of the key strategic thrusts was to adopt new and emerging technologies as part of our innovative solution for our customized fabrication methods.
By using available 3D scanners and computer-aided design softwares, we were able to capture and manipulate a 3D image of the patient's body part. This has digitized our otherwise conventional process of manually using plaster of Paris casting and modifying it by hand. Digitization process with 3D manipulation brings better value to patients, as the design can be further augmented with complex architecture and geometry for greater comfort.
Our team aims to bring in technologies to facilitate our work processes and mitigate errors to be an efficient laboratory with quality and most accurate results. Each initiative in this transformation journey brings something new, something different into primary health care. Innovation means something new, something that improves our work processes and the time taken for results to be ready, the shorter the better. The main outcome achieved is being able to maintain our main processing laboratory with 1 or 2 staff despite a 60% increase in workload over the years.
SGH redesigned our surgery scheduling processes so that patients can receive surgery instructions via SMS at home versus having to wait 45 minutes for a nurse to spend a mere 10 minutes conveying the same information. We believe that the time a patient spends at SGH should be for care and not administrative matters. Previously, clinically trained listing nurses schedule surgeries. Work redesign and training has enabled our patient service associates to take on the scheduling of surgeries. This frees up our listing nurses to be redeployed to focus on patient care. By embracing digital change to rethink our processes, we are able to right-side manpower and upskill our staff.
Our team at NHG Polyclinics developed a chronic disease care model that empanels patients to a team that we named the Teamlet. So this Teamlet consists of 2 family physicians, a care manager who is a nurse trained in chronic disease management, as well as a care coordinator. The NHGP Teamlet care model has innovatively reorganized our current resources to optimize the role of each of our healthcare providers in the care of our patients. Our patients are able to see the same team of healthcare providers over the long term, helping them to build a stronger relationship and empowering them to better care for their health. The team-based approach has resulted in sharing of tasks between the doctors, care managers, and care coordinators, and there has been improved communication and support within the teams. With the NHGP Teamlet care model, we have seen an improvement in patient health outcomes, especially for those with poor diabetes control. There has also been a reduction in emergency visits for diabetes and hypertension-related issues, and improved preventive health screenings. I think that there are 3 main factors for the success of the development and implementation of our NHGP Teamlet care model. The first is a clear vision of what success looks like. This is backed by evidence and adapted to our local context. The second is strong support from senior management. The third is the use of a multidisciplinary approach. Different thought leaders enabled the refinement of the project, and regular feedback from our clinic teams allowed us to make adjustments to improve the model. This has enabled us to develop a care model that has been implemented in all 6 polyclinics and paneling about 120,000 patients.
Key to successfully embracing digitalization, we would need to first determine the value propositions for our patients, staff, and organization.
Do not be limited by existing functions in enterprise systems. Workflow redesign to incorporate tools available online can help jumpstart projects.
Everyone likes a home that has new fun things, new technologies. Workplace is like a second home to many of us where we spend half the day or even more. So it's practically what you're already doing at work and applying it to work context in your second home too.
We should be supportive of all members of the team and encourage staff to be open-minded to find solutions to problems, as engaged employees would naturally be innovative.
Creativity is within each and every one of us. Do not underestimate the ideas which are generated by our team members.
Do not settle for the status quo, especially if there's no good evidence behind routine clinical practices, no matter how insignificant they may seem. Never take no for an answer.